out of 150, approximately 145 questions were from Bailey and Seviston only, sir. The majority was from Bailey, sir. So I focused on that part only, the Bailey and Sebiston. I was revising the Bailey and Sebiston, focusing on the MCQ, which were from the Bailey and Sebistons, and the uh, looking for few videos which explain why something was there, where concepts are there, how the MCQ can be framed, how question can be asked. For that, I was looking for Miro videos, sir. At that time, sir, because just 3 months were left, I was putting approximately, sir, 12 to 15 hour a day. I left my job. I was just putting 12 to 15 hour a day, and I planned that I should complete the majority of my videos within 4 to 5 days, which I don't know. Not just 75 hours videos. Within 3 to 4 days, I planned that I should watch these much videos only, and within 3 to 5 days only. And I must revise that videos within extra 3 days, sir. Out of total number of students, at least 30 to 40% students knows that how to attempt this question. Everyone starts reading from the Bailey page number one only, then start revising, again revising. So it's initial 7 chapters is like that, sir. Everyone knows. So, but when we start reading, that part is something that no one knows. At the initiation of our preparation, no one knows that initial chapter. At the end of at the mid of preparations, I think, sir, when I was attempting the question from that part, the correct response was very high. The previous times I wasn't within the rank category. Like I was performing well in my test, but I was not in even top 50. And the rank deciding at that time was the pediatric surgery. And majority of question from pediatric surgery I got wrong. So I tried to attempt the pediatric surgery from the squads this time. I tried that. I only thing I left is just squads. So I tried to cover this from squads only. And so this time it's turned out to be different. This time the CTVS was the rank deciding. The majority of my question wrong from the CTVS only.
Hello everyone, I'm Dr. Rohan Khandelwal, your Marrow General Surgery faculty. And I have the pleasure of introducing Dr. Bhimsi Kandoriya to you, who secured rank 3 in the recently concluded NEET SS Surgery exam. Heartiest congratulations, Dr. Bhimsi. All of us are extremely happy and proud of you for achieving such a great result.
Thank you, sir.
So, Dr. Bhimsi, please tell us more about you. Where did you do your undergraduation and your post-graduation from? And when did you start preparing for the MCH exam?
Sir, I cleared my undergraduation from BJMC Ahmedabad, and I cleared my MS in year of 2021 from Maulana Azad Medical College, New Delhi. And sir, after clearing my examination in year of 2021, August month, I started preparing for MCH, not before that one. And our examination, my first attempt was just after 2 to 3 months of my completion of third year. So at that time, sir, the rank was bit marginal. I was getting some DNP seats, which were left by many one. Like it's optional choose. So after that, I start.
If you don't mind sharing, what was your rank in the first attempt?
Sorry, I'm not exactly knowing, but it was, sir, 132 or 133.
Okay.
It was, sir, specialty wise rank in GI surgery only.
Right. Perfect.
Yes, sir.
Perfect. So you wanted to do GI surgery only. You were very clear you wanted to do GI surgery.
Yes, sir.
Okay, perfect. So this was your first attempt, which was 3 months after your MS, and you did not study much. Whatever you studied for MS, with just that knowledge, you appeared for the exam.
Yes, sir.
Okay. So what was your preparation after this result? How did you start preparing?
So after they announced that the exam is going to be a MS exit exam only. The previous attempt was, sir, based on the Shackelford and Blumgart only, and this attempt was going to be from the Bailey, Sebiston and squads only. So I focused mainly on, sir, Bailey and Sebiston only, and because initially it was in everywhere it was going to be like it's going to be from Sebiston only or Bailey only. The few questions were in actual reality only, sir. The out of 150, 5 to 6 question is going to be from squads. Like one question I remember was one syndrome. It's going to be it's typically one from the squads. Otherwise, out of 150, approximately 145 questions were from Bailey and Seviston only, sir. The majority was from Bailey, sir. So I focused on that part only, the Bailey and Sebiston. I was revising the Bailey and Sebiston, focusing on the MCQ, which were from the Bailey and Sebistons, and looking for few videos which explain why something was there, where concepts are there, how the MCQ can be framed, how question can be asked. For that, I was looking for Marrow videos, sir. General surgery part Marrow videos only, sir.
So when did you start using the Marrow SS plan, and when did you start watching the general surgery videos?
So general surgery videos I started watching just 3 months before my examination, just 3 months before, because
Right.
at that time I still was not sure from for my urology part. I wasn't read that urology part from even Bailey, so I was looking for the videos which can directly tell that what to read and what not to be read. So
Mhm.
during that time only.
So, Dr. Bhimsi, a lot of students ask me how much time for a postgraduate to watch the general surgery videos, right? Because the postgraduates already have some knowledge, and my general
Yes, sir.
surgery content is around 70 to 75 hours for super speciality. So, how much
Yes, sir.
time did it take you to finish the videos, and how many hours were you putting in every day?
So if at that time, sir, because just 3 months were left, I was putting approximately, sir, 12 to 15 hour a day. I left my job. I was just putting 12 to 15 hour a day, and I planned that I should complete the majority of my videos within 4 to 5 days, which I don't know. Not just 75 hours videos. Within 3 to 4 days, I planned that I should watch these much videos only, and within 3 to 5 days only, and I must revise that videos within extra 2 to 3 days, sir. So I complete, but for sir, if we are having margin of 8 to 9 months for preparation, then sir, the 8 to 9 days is going to be fine, sir. If you are watching for 7 to 8 or 8 to 10 hours a day for consecutive 1 week or 7 to 8 days, sir, then it's going to be, sir, 1 week is enough. For revision, 5 days extra is enough. And when we are looking for some MCQs where we remember is that still I don't know this concept, or still I don't know how to frame the question or MCQs from this one, then I can go for those videos only.
So you're making a very important point, and this is what I tell all people who are preparing for MCH, that it is very important to revise rather than just watching
Yes,
the videos once. It is important to revise. So,
yes,
because you already have knowledge, an MS student already has knowledge, they should watch the videos quickly. And as you rightly said, that even if you watch 7 to 8 hours every day, you can finish all the general surgery videos in 8 to 9 days. And
yes,
then even if you give yourself 5 to 6 days more, you can revise those videos again, and you can revise them while doing MCQ. So that is the key. Revision is the key, and it does not take more than 9 or 10 days to finish the general surgery content.
yes.
Perfect. So, were you also did you utilize the general surgery Q bank, which we have in Marrow, while doing the videos? Did you utilize the Q bank as well?
Sir, I wasn't utilized that QBank that much, but I at least attempted 40 to 50% question from that one, sir. Because
Okay, so
that
40 to
was, yes,
50%
sir.
of the general surgery Q bank you've done.
Yes,
Perfect.
sir.
Right. And again, for I want to know, somebody who already has knowledge from their MS, which portions of general surgery does a MS pass out find tricky? Is it the
Yes, sir.
general surgery part, the shock part, or because I feel GI surgery you all have seen in 3 years. So which are the
Yes, sir.
portions which a normal MS candidate finds tricky?
Yes, sir. Initially, when we are start preparing, sir, the general surgery, the part of initial chapters are the tricky initially, sir. Because when we revise it for 3 to 4 times, like I started watching videos from Miro. If I revise it 2 to 3 times, it's going to be easy. But if you that's strict, even no one want to read that part, sir. Everybody knows that it's going to be bit data only, and then the soak and multiple trial, and some in Subistan it's going to be multiple trials and everything is hazy bit. But when we are revise this for 2 to 3 times, it's going to be a bit clear. And after that, it's not going to be rank deciding. It's like that key, out of total number of student, at least 30 to 40% students knows that how to attempt this question, everyone starts reading from the Bailey page number one only, then start revising, again revising, again revising. So it's initial 7 chapters is like that, sir. Everyone knows. So, but when we start reading, that part is something that no one knows. At the initiation of our preparation, no one knows that initial chapter. At the end of at the mid of preparations, I think, sir, when I was attempting the question from that part, the correct response was very high.
Yeah, so I agree
But,
with you. I
but
agree that the initial 10 to 12 chapters, and I would also go and say trauma and burns, those are the chapters which are the real differentiators, because
yes,
not everyone understands the concepts of those chapters. And
yes, sir.
GIT, everyone would be reasonably strong because that is what they're
Yes, sir.
seeing during their post graduation. And urology also basics are asked. I mean, this time also not very difficult from questions from
Yes, sir.
urology were asked. So that general surgery portion becomes very important. So one more thing which I want to ask Dr. Bhimsi is what are your views regarding pediatric surgery? Because I think so both this year and previous year there were few
Yes, sir.
questions from pediatric surgery. So how did you approach that portion of your preparation? Was it only from Bailey and Sebastian, or did you do some other resource as well?
So the previous times I wasn't within the rank category. Like I was performing well in my test, but I was not in even top 50. And the rank deciding at that time was the pediatric surgery. And majority of
Hmm.
question from pediatric surgery I got wrong. So I tried to attempt the pediatric surgery from the squads this time. I tried that. I only thing I left is just squads. So I tried to cover this from squads only. And so this time it's turned out to be different. This time the CTVS was the rank deciding. The majority of my question wrong from the CTVS only. So, but I covered it. So like it's 70 to 80, 70% was right and 30% was wrong around that. But this time, sir, they were perfect in that way. They will ask exam or questions from the exit level only, and the majority of questions were from that part only.
Really
But
excellent.
based on my past experience, I try to change bit, and I covered a few chapters from the squads like the brace, thyroid, and the pediatric is extra because that was a bit difficult for me. I don't know question from that part.
In the Marrow videos, did you watch some of the subspecialty videos as well, or you just focus on the general surgery content?
No, sir. I just focused on the general surgery content, and the reason for that, sir, was simple. That they said our like Doctor, the HOD, our department HOD from Dr. Poinder Lal was HOD, and everybody was talking that the exam is going to be from exit level only. So I decided that let me believe in our teachers and everyone. Let us think that the exam is going to be from MS passing subject only. So,
Right.
so I try to read that only.
So, Dr. Bimsi, what would be your advice to somebody who's just entered post graduation? Right now, you know the NEET PG counseling will happen, and some people will take up surgery. You've done surgery from one of the premier institutions in the country, MAMC. So, what would be your
Yes, sir.
advice? How should they approach the first 6 months? What books should they read during post graduation?
Yes. Actually, the general surgery was not by choice. Uh, Initially, during first year of my MS, I was bit hedges that I should continue or not. But yes, I was interested in general surgery. Before that, I completed a year in MD radiology from BJMC only.
All
After
right,
at the end of completing MD radiology, I was like, I don't know to do that. So
that's interesting.
yes, sir. I exited from that area and I was interested in the biopsy. Like in our institute, there was a biopsy protocol. Okay, like everything should be done by from single first year PG will do biopsy, like in USG guided biopsy, CT guided biopsy, and that things get me enrolled in surgery part. Okay, I should attempt it. Like I should go for surgery. And when I started, it became a bit hazy for me because I trained in the radiology where life is bit easier. Like you can get a proper sleep, you can go get a proper food or something. Or here it was like 24-hour emergency. So it was first year was a bit difficult for me, but sir, as a branch wise, I was highly satisfied. So I keep other of my colleagues, which were by choice, for them all, they decided for the general surgery specialty during their internship only. So for
Right.
they started reading for the super specialty in the year of second year or third year, sir. I started reading a bit later on, at the end of my
So
third year. For
will that, I mean, will you recommend that they should start reading from second year?
yes, sir. If someone is planned for super specialty, the majority of like 20 to 30% are not planned. Majority are planned for super specialty. And this case, in that case, sir, everyone should, I think, should start.
Perfect. Perfect. Right. Thank you for talking to us, Dr. Bhimsi, and for sharing your valuable tips. We wish you all the very best. And before we
Yes, sir.
end the discussion, which institute are you planning to take up for hepatobiliary?
Sir, GB Pant.
Great.
Yeah. Yes.
That's a great institution to train. We wish you all the
Yes, sir.
best. Thank you very much for your time, Dr. Bhimsi.
Thank you, sir.